it's pretty easy to fill a tooth or do a crown on a tooth, but when you're talking about putting something back together, so when you've got somebody who's not just got one tooth that needs treatment, but maybe many or all of the teeth that potentially need treatment, it's a lot more complex and a lot more challenging. There's a lot more parts to it. I didn't have someone in town that I felt comfortable referring to or even bouncing some of these full mouth ideas off of to understand more about what these patients needed and could receive. And so I really sought out the best, in my opinion, the best in the world, to learn more about it, to be able to bring that back to town. And it's really important to me because when someone needed that, my only option was to refer them to maybe Omaha, maybe Lincoln, maybe even further, Kansas City, Iowa City. There's prosthodontic programs, but they're in larger places, and we just really didn't have someone who could help with that. So I really tried to focus on becoming the practice that could take care of basic needs all the way through the most complex things that a patient could possibly need, and I feel like we can really do a really great job of that now. The best part in dentistry is when you get done with a case or you get done treating a patient and you hand them that mirror and they take a look at the mirror, and either they get the really big smile on their face, or sometimes we actually get tears of joy. And, it pulls on everybody's heartstrings, but also it really exhibits the amount of impact that we can give someone. Because what more do you use in a single day than your teeth? There's very few things in our lives that we actually use more. We smile, we speak, we chew, just self-confidence wise. And it's really cool to see people who have gone through the transformation dental-wise, but also to see the transition and the transformation of the people themselves that receive those services. So that's definitely the most rewarding part. When a patient contacts our office, they're looking for something. They're looking for a home to take care of their teeth or their family's teeth, or they're looking to solve a problem. And it doesn't have to be both. Sometimes people just need cleanings and checkups. But when I have someone that comes into the office, whether it is something very basic or just normal checkups and cleanings, all the way through really complex treatment, I want it to be easy. Our team talks about that a lot. We want them to be able to call and find what they need. And if we can help them, receive that, if we can help them receive what they're looking for in an easy fashion, they're more likely to send their friends and family to us as well. And so I think that's our biggest goal, is that we really want things to be easy. From the time they call to the time they walk out the door. Dentistry can be scary for a lot of people, so we want it to be not only easy, but we want it to be comfortable. We want to have a good time with patients. We try to joke around and keep it lighthearted, but we also want to provide the very best, world-class dentistry here in Norfolk. So that's what I want people to realize. When they come in, it's easy to get what they're looking for and get on with their lives.